This is just a general range for scoring. But this is a nice plan to talk about what you do when certain scoring results come up, certain levels, and they're discussed openly with the mom, explain how it's going to be, how the information is going to be handled, listen to what her concerns are about it, educational materials provided, for example, in the 9 to 12 range, informing the medical provider, because none of this should be done alone. It should be done with basically the medical team. So just take basically a quick look at this. And then, as I say, number 10 is the one that requires immediate concern. JCO is concerned with this, and this one requires immediate psychiatric intervention. Medical model of screen and refer is going to be, right now, very limiting, and we're going to have to find other ways, and that goes back to the life course model, of intervening to support moms, because not all mental health professionals are trained. Poor moms, the resources in the community are not matching the need, and so it's going to require, and other states have done this, much more creativity on our part about how we support well-being and how we define intervention. And it's not, as I say, it's not just going to be screen and refer, and I really understand that that is an issue for people, and probably a good discussion is what have been the problems that you've had with this, or what has worked. What have you been able to develop? What educational materials have you used? I just want to touch on suicide in the perinatal period, and just to say that you know, for me, one of the beauties of living in the Bay Area is the Golden Gate Bridge, but that's not how it's seen for everyone. It's something that the media has both informed the public about, the idea of perinatal oppression, but in such in such horror that it sometimes has worked against any kind of public education on the issues of perinatal depression or perinatal mood disorders, and it makes sometimes moms not being willing to speak up. Very often issues of suicide are around a diagnosis of bipolar, especially bipolar 2, and also postpartum psychosis. And that occurs in 1 to 2 per 1,000 women, and is usually seen in the first 30 days postpartum. And so sometimes, as one gets skilled and can get support, you can ask questions. You know, the question that's asked is, do you want to hurt you or your baby? And if a mother scores highly on the tool, then done with equal compassion and control, compassion and support, both for you and doing that particular work. It's a matter of how do we get this mom connected, once again, with her providers and then other mental health professionals. So, as I say, this is for further discussion. I want to emphasize, in the time remaining, the idea of social connectedness. This is wording that comes from the San Francisco Suicide Prevention Hotline. And as a rule, when you see these hotlines, they usually say, "Are you suicidal?" What this wording is, and so much of the work you do, is going to be about how things are worded. Notice how this feels compared to, "Are you suicidal?" If you feel that the pressures of life are too much to bear, tell someone. Inherent in these phrases are actually the solutions, or the start of the solution to well-being and connection. That first question is normalizing, and I guess I want you to think this in terms of things that you can say to a mom. It sounds like you have a lot of pressures in your life, and it can get overwhelming. I can understand how that could be. And that the idea of tell someone. And that is basically the start of it. And I don't mean to make this very simplistic, but to me, that's one of the beauties and one of the gifts of this, is the wording, that we don't just focus on all that's wrong, but we go to what are the keys around well-being, and how do we start to make some connection so the woman has some sense of self-efficacy about what she can do to change the state, or where she can go for connection. There also is a reduction in shame and a reduction in stigma if we're not just saying, "Are you suicidal?" but we're saying, "You're burdened." So let's just look at some ideas for intervention. So for those of you that do screening, discuss, how do you work with the mom on the results that she gets? How is it presented to her? Is it in the idea of how burdened you must be? And what is it that we can do? is there somebody you can talk to? Very often the answer will be no. And it can come out of a sense of being overwhelmed, fear, shame, etc. And then we can often say, well, you've just talked to me. Because in a state of depression or anxiety, people forget what they already know. And it's our job to be reminders for that. And that goes to the second one, that there are resources that we're trying to see. What are the internal resources of the mom? What are the social resources of the mom? What is her ability to relate to us? Can we form a relationship with her to some degree? And it may be a lot of work. And as I say, it's not usually something that we can do again alone. And what can be done in the community to coordinate? And that would be, we'd have to find out what's going on in the community. And I realize this part may not be your responsibility. You have much, much more to do, for sure. But we're trying to maximize well-being. And instead of just screen and refer, we're trying to see what is also available there that that mom can use. We're trying to give the mom a sense of connectedness, self-efficacy or control, and perspective. That's what gets lost with depressive thinking and excessive anxiety. It's the thinking that gets disturbed, and it's hard for a mom to get a sense of knowing what assets and things she can reach out to, and that's a bit of our job. How do we remind her? So if you have family members that sometimes seem like they were in the way, they may be useful, and they may be useful to educate them about this and help them understand. And there's excellent, excellent materials out there that we can hopefully share, and I can give you a few. And then obviously screening and referral, if it is severe, absolutely needs to get done, knowing full well that there may be a lot of waiting time involved, and because that system is really quite broken right now. And that we go to the provider too, and we ask them to share in supporting this well-being, knowing that their professional agencies and probably their sense of humanness are, you'll find that you can have a team, this can be a team effort. So as I mentioned, we're thinking therapeutically. We're not therapists, but we're thinking therapeutically, the idea of moving towards some sense of well-being. And we're always trying to keep an eye on the prize of reducing isolation and moving towards some connectedness. And connectedness for some folks, although we can't make assumptions, is saying things like, I was really thinking about you. I'll keep you in my mind until I see you next time, okay? Sometimes touching someone, etc. These are all, or really looking at someone. These are all issues of connection that you do have to match attunement, but these are, they're seemingly simple, but they're absolutely critical. And nurturing interaction. So a lot of what we do in our tone of voice and in caring and reminding a mother about what she did do right about her diet plan is going to be extremely significant, and this is well documented in research on intervening with maternal depression. It's it's called a parallel process, and it's an issue of some sense of nurturing. I'm really impressed with what you were able to do. I really understand that there were times that you couldn't adhere to it, but let's look at what you did do right, because sometimes for us that's difficult to do, and for a mom who's depressed, for example, it's even more difficult to do. Whatever we can do to normalize or reduce the stigma, and so that would be in bringing it into the room and saying things to her like, how are you today? How are you doing? That makes it quite normalizing, gives her the sense she can just bring it up with you. I think I reviewed some of these, and the idea of what do you think you'd be able to do? Inherent in that question is an idea of that I know that there is something, that you have a sense of what you're going to be able to do. And moms need reminders of that. Issues of follow-up calls are critical if they can be, or an idea of be thinking of you until next week. There was a wonderful study that was done in Australia on suicidal women that came into the emergency room, and they found out that when they sent out postcards of the women that have taken overdoses, and they sent out postcards to them saying, please remember if you need to talk to us, please call us. We're wondering how you're doing. And at 5 years out, they had a 50% reduction in women returning to the emergency room. So there's a lot more to be explored around this, and it's a very interesting study if you're interested in it. But just to remind that there are simple, seemingly simple interventions that are really important. For ourselves, there's no need to fix. That's often what we do in the helping professions. We'll try to fix it. We may get angry at a woman because we're overwhelmed or dysregulated by the mood that she has, and we can quickly go to, well, she's not very compliant. Certainly can understand that. And do you yourself have some support within the work that you're doing for this? I'm going to just go past this and just go on to some websites. If you don't know these websites, please do yourself a favor and do check them out. This is Postpartum Support International, an amazing website where you can find all sorts of information. They actually have therapy online for moms, etc., and extensive information that will support you. Even though it's Postpartum International, it was started 20 years ago, it is perinatal. Some other excellent websites, if you don't know, is mededppd.org. Once again, it says postpartum depression, but it is perinatal. You'll get CEU training classes, excellent research, and is basically one-stop shopping. And there are excellent ones. The other one, Women's Mental Health, the one out of Mass General, is, if you're especially interested, issues around psychotropic medications, more severe mental illness, and around breastfeeding, etc. It is excellent. Other countries like Australia have done very, very good jobs, and we have much to learn from them. And this is a reminder from CDAPP that if you go to the guidelines, if you go to the website, you will find some tools that may be useful to you in this area. The issues of domestic violence tools, etc., stress checks, and the Edinburgh scale is on the CDAPP website.